We're back with our continuing coverage of Men's Health Awareness Month. This afternoon, we're taking a moment to look at orthopedic injuries, more common in men, and how they can be prevented. Dr. Jeffrey Johnston, our go-to orthopedic surgeon, joins me live in studio with some advice. Thanks for coming in.
Yeah, thanks for having me.
Appreciate it. So we know that a lot of times it's these weekend warrior injuries that lead men to get hurt. What are the most common you see?
Right. So, weekend warriors, of male or female, are prone to athletic injuries, not all that different from what we see in normal athletes. I think in males in general, just due to different body makeup, tend to have a higher skeletal muscle mass, so they may be more prone to certain tendon and ligament injuries. A couple good examples: Achilles tendon injuries, distal biceps injuries, or proximal biceps injuries. We tend to see those more commonly in males.
What about those occupational injuries? People having to lift too much, or continuous motion, maybe. Do you see much of that at all?
Right. So that's kind of two. So the heavier lifting manual labor jobs, we obviously worry about traumatic injuries. So crush injuries, fall from height, those types of things where you have more potential for fractures. The overuse, the repetitive continuous motion, you see maybe more of the overuse injuries, the tendonitis, those types of things, which can usually be managed, more conservatively.
I want to get to kind of the criteria between when you can just ice it, rest, take some painkillers, and when maybe you need to go see a specialist. But first, are there home remedies, home treatments available for people if maybe they're hurting a little bit?
Sure. I think, as you mentioned, some of it, if you're able to walk, for example, if you have a lower extremity injury, if you're able to walk, weight bear on it, you're probably safe with starting with the anti-inflammatories, rest, ice, those types of things. If you're having trouble weight bearing, those are things you'd maybe need some earlier attention with, getting some imaging studies. Similar to, with upper extremity problems, a lot of things can be managed at home with simple things around the house. And then, if those aren't improving over, several days or so, it may be worth getting some attention.
And you may not necessarily need surgery per se. It could just maybe some physical therapy or whatnot. Obviously, the doctor will help with that.
Correct. Yeah. We always try to, start with the simplest thing. We always start with conservative treatment if it's indicated. Whether it's physical therapy or just giving patients some exercise they can do on their own. A lot of times, if that's not, getting it done for them, then we talk about potentially more imaging, and we talk about, potential surgery options if that's necessary. Prevention
is always the best medicine. What do you recommend patients do if they're playing a sport or going through some physical labor?
Yeah, as far as sports, I think, appropriate warm-up, stretching, and then I think probably most importantly is playing within your means, not trying to do too much. We all think we can still do certain things, and I think you need to kind of stay within your realm. As far as the, the work type things, I think just following the safety precautions set up for, your job, and I think maintaining alertness.
So I'm a soccer player. I was asked to play in a soccer tournament coming up in July. I'm going to go out there, but yeah, I think what you said, stay within your means. Yeah. I'm not trying to play in the World Cup. Right. So I think great advice, I think, for anybody out there. A lot of us older guys, we like to just think we can still
I think you get caught up in the moment. You try to, you don't think about that stuff.
Right,
so
absolutely.
It's easy to do.
And the older we get, the more aches and pains I get just doing regular day stuff.
That's right.
So, Dr. Johnston, we appreciate you coming in and taking the time to answer our questions.
Thanks for having me.
As always, thank you.